One of the common questions I get is, can I just get some filler? I don't want to get surgery. I'm not ready for it. I don't have time for it. I'm just going to do filler for a while and then I'll get surgery. And what people don't realize is there's a big difference. It's kind of what I call camouflage versus correction. Camouflage is when you're not really improving anything, but you're camouflaging it. I kind of like to compare it to, we're not really cleaning up the room, we're just throwing it all in the closet. And so it's like when you have a little indentation, you put some filler in. If you think about it, just basic logic, if you have something that's puffy and you have an indentation, it's almost like you have a small hill and you have a small valley. And we're trying to reduce the hill and raise the valley and make everything a flat plane. Well, in reality, when you have the small hill, you can't reduce it with fillers. All you can do is fill the valley, and now you have a small hill. Everything's a small hill, so everything's puffy. That's why when you look at people, they don't have a lot of wrinkles, but they look puffy. They look swollen. They look like they just kind of got a jab in the arm and somebody just pumped up some air and and they get the wrinkles out. That's camouflage. That's fillers. You can get filler overload and you lose your dimensions and you start seeing people kind of a round face. What's really needed is to do a holistic approach, take somebody's anatomy that they were God-given, put it back where it belongs, and that's corrective. But what happens is people do a stretch look and you need to rebuild from the inside out. The first thing that changes is the bony area. The next thing that changes are the ligaments that attach things. Then it's a muscle, then it's the skin. The most common thing you see is people will start from the outside and go to the end. And the reason they stretch so hard is because they didn't rebuild it from the inside out. At Oculus, we rebuild it from the inside out. So a lot of times, we never make an incision around the ears. We don't give you scars on your face. It's all reconditioned and rebuilt to what it was before. That's why I tell people, the reason with my patients you don't have to worry about not looking natural is I'm taking your natural anatomy and all I'm doing is fighting gravity, which never goes to sleep. It's awake 24/7, and we're just replacing it where it used to be. So you're going to look natural. So when people bring me an old picture of a time in their life when they're happy and how they like to look, I can reproduce that because I'm rebuilding your own natural anatomy. That's what I call the Oculus difference.